Kaisa jorao malaria bemar kotor kaisa bemar bai baksa jora slaijama bai bemar bai ya katinani samunglo simung rokbo phaika fia tabugo baksa thayo bemar bai yak kaksugi maya tongkho sangrongsalo haste health and family welfare society ni bukhaktwi Raj Bhavan World Malaria Day palaijakha oro nograi ingi manjakha hastefa Indrosena Reddy nalu লগিও জাতীয় স্বাস্থ্য মিশনই তাংফাং অকরা বিনিময় ভূষণ দাস ন খবই কুবনি আদং সংব তংবাইখা
World Malaria Day annual observance held on April 25th to raise the awareness of the global effort to control and ultimately eradicate malaria. Malaria is a serious and sometimes fatal mosquito-borne infectious disease. It is transmitted to humans through the bite of infected female mosquitoes. Malaria symptoms typically include fever, chills, headache, muscle ache, and stage. World Malaria Day is to raise awareness about malaria and to mobilize efforts to control and eliminate the disease. It was established by the World Health Organization in 2007 to highlight the global burden of malaria and to promote actions to prevent and control the disease. World Malaria Day is an occasion to highlight the need for continued investment and sustained commitment for malaria prevention and control. National Vector-Borne Disease Control Program NVBDCP is a key national health program being implemented in Tripura since inception with a goal to prevention and control of malaria. Under intensified malaria elimination program 2, it is targeted to eliminate malaria by 2027. Tripura state is working for malaria elimination within the stipulated time frame as per the National Strategic Plan 2023 to 2027, and many steps have already been adopted. Malaria has been a challenge for the state due to several malaria epidemic pockets in few districts like Dalai, North Tripura and Gomati. Being a local and focal disease, the malaria cases is being closely observed through a robust mechanism of supervision and monitoring starting from the sub-center level to district level officials attached to the program. To prevent and control of malaria, few steps have been taken by the state government. Strengthened active and passive surveillance, ensured early diagnosis and complete treatment with proper follow-up, home-based treatment by the accredited social health activists, community health worker, strengthened supply chain management, trained all accredited social health activists, multi-purpose workers and medical officers in a phased manner. School awareness program. Due to focused intervention malaria testing, substantial decrease in death due to malaria has also been noticed. Though recent increase in malaria cases is a challenge, but the state has moved forward from the times of 84 deaths in 2014 to only 1 death in 2023. It has been made sure that all logistics, including the drug and diagnostic kits, reach up to the accredited social health activists in an uninterrupted manner. In addition to the grants under the Global Grant for AIDS, TB, Malaria Eradication through National Health Mission, the State Health Department is also making necessary contribution, especially with the injectable drugs for treatment of severe and complicated malaria. The 118 primary health centers are ensuring that the microscopic diagnosis of malaria parasite with the support of quality assurance by state and regional quality assurance laboratory. The malaria centennial site hospitals are contributing to the treatment of severe and complicated malaria. People living in the most vulnerable situations, including pregnant women, infants, children under 5 years of age, refugees, migrants, internally displaced people, and indigenous peoples continue to be disproportionately impacted.
আগরতলা নিসেমি প্রণব নিকথম ব্যুরো রিপোর্ট